we were in the hub last week, and you said to me that you think that innovating in health is arguably one of the most complicated, difficult, possible sectors that you can approach innovation in. First question is, why?
So I'm regretting now saying that question probably out in public. It's hard because of several reasons. But the first reason is bureaucracy. It's sometimes difficult to get through the various gateways, know who to connect with. And this is no disrespect to those that work in the NHS. I myself, I'm a non-exec director in the NHS. It's about finding the right people to work with. Once you find the right gateways and you can overcome the bureaucracy, then it does become a bit easier. It's time. There's the need for patient safety, obviously, and the regulation. These are people, these are patients at the end of the day. So there's something about safety and also compliance and having to do rigorous testing. So it's no wonder that it becomes a marathon almost in terms of having that time to innovate and then bring something to market. But this is why having spaces like Future Space, having innovation hubs are really, really important, because the biggest thing is about the resilience and about the need to maintain confidence, particularly if you're starting out, because when you're burning through that cash, and Peter and I have come across several companies, small fledgling companies that are burning cash at the rate of knots, your time is running out and you're desperate to land that first check because of your product or your service. So there's a real constraint. So someone putting their arm around you metaphorically and working with you and showing you the way is one way to overcome those challenges. That's my starter for 10, Matt.
Yeah. Wow. Feroz, I guess similar question to you, but I suppose what's broken? Why is this so difficult?
I have to be careful with what I say because I don't think the NHS is broken. I believe we need to take a step back. You know, when you're engulfed in trying to firefight with multiple areas and multiple things, it becomes extremely difficult for you to understand how you can address the issues in order for what we say to refix what we think is broken. I think the NHS as a system is amazing. I think the services that are delivered through the NHS are absolutely second to none. But where we have to look at is, where are the inefficiencies? Where can we actually go in, drop ourselves at go from 30,000 feet and then look down? I remember one of my mentors, he said to me, he said, if you ever find yourself in a sandstorm in the desert, he said, what would you do? Would you carry on going to your destination? And I was like, no, because I'd probably be blinded. And he said, that's exactly what happens when you're in a sandstorm. Sit down, cover yourself, take a break, and then when the storm subsides, don't keep yourself within the storm, take a step back, and then you'll find your way. Mm-hmm. And I think that's exactly what the NHS needs right now, is to take a step back and find a way rather than firefight.
No, good. I like that. I'm going to jump a little bit to what you guys are going to be doing together. We've already started together. In terms of the Integrated Care Academy, the awards, the upcoming project. But before that, Mark, for those maybe don't know, what is the Integrated Care Academy? What's the mission?
So this probably is one of the most asked questions that I get these days. Ultimately, it's how you bring people, how you bring knowledge and innovation together to solve real-world challenges, particularly in the health and care space. Those challenges can be on the ground. Those challenges can be things that have not been even conceptualized yet. They can be grand challenges across systems. They can be working across local organizations. Ultimately, it's about how we use the power. I'm using power in a positive sense here, across a university like UWE Bristol, working with its partners across multiple systems to actually bring positive good for society. And with a real theme around workforce, digital tech and adoption, and service innovation and evaluation. It's that simple.
Wow.
If it doesn't fit this, we don't really look at it. But I can tell you now, we're yet to find, Peter and myself, a case where that isn't happening. So as long as it fits one or more of those, then actually we're interested.
That's awesome.
One of the strands of the ICA is, of course, the awards that you've offered this year, which very generously supported SAH quite recently, which is being led, which is still around, Amy Beardmore. Feroz, can you tell us a little bit about what that project is? What are you looking to do?
So, as I mentioned in the introduction to SAH, we've built the Bradley Stoke Clinic, which was supposed to be our office, but turned it into a clinic. We want to drive community health, which has just been announced as well. The mobile unit is here. You know, as I mentioned, I'm more than happy to give a tour of the mobile unit. What we want to do is with the partnership that we've got with the ICA, is learn about population health, learn about the health inequalities, understand how we can reach the population at an even at a much faster pace, and then bring those patients in to benefit them. And I do believe that if we get this right, this could be a model that can be used throughout the country, not just in Bristol. And one of the other things that I don't think we've had a conversation about yet is the power that this brings to research, the analytics that this is going to bring in for us, and the knowledge base and data that we're going to have. That translates into research, not just research analysis, but research projects that I believe major pharmaceutical companies, major companies that are looking at innovation will be drawn towards. But when we do this, we're going to make a difference with the patients, because now we're getting into faster diagnostics.
I guess it's self-explanatory, but Mark, why did you back it?
We backed it because it first of all spoke to what the ICA's concerned with, which is what Feroz has just outlined. It spoke to us because of just its innovative approach, which again is where the ICA is trying to position itself. And it's a really good project that will make a big difference actually across populations. It's a fantastic example of the collaboration between UWE and the staff within UWE and working with industry. And we did something a bit different actually, because we are also trying to drive forward an ethos of the creation of this quadruple helix organization across UWE, which involves industry, academia, the government, and guess what, folks? People, the civic, the community. That is the quadruple helix. Wow. And, you know, this is something which is probably not that well understood still, and it's a real kick on from where things have been. But this is about an opportunity to actually change the rhetoric around how government, how media, and how other outlets view and see modern universities, because we're about solving problems. We're about making fantastic futures for people. And testament is the interns that you've been having in your company. That's what modern life should be about. The MBA that Matt's spoken about, this is about partnership working. This is what a modern university should be about.